Hello, I'm Davide Capodanno, the editor-in-chief of EuroIntervention. Today I'm happy to be here with the deputy editors of the journal, Nieves Gonzalo, hello, and Darren Mylotte, hello. Hello to both of you. So what we are going to do now is to present you the top 3 cited papers of the journal from EuroPCR 2020 to EuroPCR 2021. So it's a kind of award ceremony that typically we have at EuroPCR in presence, but we have transformed a little bit and converted it into the digital format as it is common in these days. So we are talking of papers that are ranked by citations here. And this is, of course, important for any journal because these are papers that will contribute meaningfully to the impact factor 2021, actually, released in 2022. Sounds complex, it is, but basically this is the way it works. So I would start immediately asking Darren, can you comment on position number 3, please?
Sure, Davide. So no surprise that this paper was highly cited. The title is Diagnostic Performance of Intracoronary Optical Coherence Tomography-Based versus Angiography-Based Fractional Flow Reserve for the Evaluation of Coronary Lesions. So essentially this important paper was a multinational collaboration led from Shanghai in China by Dr. Zhou Huang. This was a single-center retrospective study whereby the authors compared OCT-based optical flow ratio compared with angio-based QFR with wire-based FFR as the reference standard. They did a lot of work in this paper. They had paired comparisons in 212 vessels, 181 patients. And remarkably, what they showed was that OFR actually had a better correlation with FFR than QFR did. It had a sensitivity of 92%, a specificity of 86% for OFR to identify an FFR less than 0.80. So in essence, an important paper moving forward our ability to get not just anatomical data from OCT, but also functional data. And I think that those of us in the community who use these technologies on a day-to-day basis really will find this a very important paper and contribute a lot to our day-to-day clinical practice. So a great paper, but Nieves, what did you have coming in at number 2?
Thanks, Darren. So at number 2, we have a paper entitled Validation of a 3-dimensional quantitative coronary angiography-based software to calculate fractional flow reserve, the FAST study by Dr. Kaneska and colleagues. So again, is a paper about software to try to obtain functional parameters from the angiography in this case. Is a validation of a software that calculates FFR based on 3D reconstructions of the angiographic images. So the authors validated this system in vitro and then in a retrospective cohort of 100 patients with invasive FFR measurements. So the main results show a very good correlation of the angio-derived FFR and the invasive FFR, actually with a very good accuracy of the angio-derived FFR to determine when the FFR was abnormal, below 0.80, and also remarkably quite low inter-observer variability. There is sometimes a problem with these angio-based systems. So I think the paper citations reflect the growing interest in this field in the development of angiographic-based methods to try to estimate the functional parameters without the need of using basically pressure wires. But now, Davide, I'm looking forward to see who's got the top position as the most cited paper of the year in EuroIntervention.
Yes, thank you very much. So yes, unfortunately, we can have only one winner. That's life, but I'm very happy to share the stage with you to congratulate the group by Lorenz, Räber, and colleague. Dr. Wecki is the first name. The paper is Validation of the Academic Research Consortium for High Bleeding Risk, HBR criteria, in patients undergoing percutaneous coronary intervention and comparison with contemporary bleeding risk scores. So essentially, essentially, this is a timely paper that we received that aimed at validating the newest criteria for the high bleeding risk from the ARC-HPR in a population that comes from the Burn PCI registry, over 12,000 patients. And basically, they showed that 40% of the patients that are commonly seen in daily practice in the cath lab are actually HPR according to these definitions. And no surprise, they have high bleeding risk, which exceeded the threshold that was identified by the ARC from the consortium, which is 4%. In this population, they have 6.4% of BARC 3 to 5 bleeding, which essentially validates the threshold that was established by expert consensus and basically shows that the concept works nicely. So I think this is the reason why the paper is cited, because this was one of the first demonstration that this is something that goes beyond the expert opinion and actually works actually to identify patients at high bleeding risk were actionable, meaning that you can take action in order to reduce the risk of bleeding. So I think very meaningful and of course something that may help clinical practice in an important way. So this was the last one. Any final comment? Nieves first, Darren second.
Well, congratulations to the authors, and thank you for sending these papers that contribute a lot to your intervention.
Yeah, to just reiterate our congratulations to the winners and to the other people who send us papers who didn't quite make the top 3. Please continue to send us your important papers, and we'll review and publish them as quickly as we can. So thank you to our community for the support you give our journal.
Thank you, both of you. For now, of course, we have to give this award virtually to Dr. Räber and colleagues with many thanks, and thanks that I want to extend to you, Nieves, the other deputy editors, for your great work in EuroIntervention, all the authors, reviewers, and editors that have contributed this year. Congratulations to Dr. Räber, and thank you for watching this video.
Hello, this is Lorenz Räber speaking from Bern, Switzerland. I like to thank EuroIntervention and the publisher Europe for receiving the award for the Best Cited Paper 2020. The paper is entitled Validation of the ARC High Bleeding Risk Criteria in the Burn PCI Registry. I wish to thank the entire interventional team at Bern University Hospital for their contribution with data collection, and especially Dr. Yasushi Ueki, who spent a 4-year fellowship at our institution and is now back in Japan.